Dawn breaks over Brussels on October 12, 1915. In the cold darkness before sunrise, at exactly 2 o'clock in the morning, a 49-year-old British nurse stands before a 16-man German firing squad at the TR National Shooting Range. Her hands are not bound. She refuses a blindfold. In her final moments, she speaks words that will echo through history. Patriotism is not enough. I must have no hatred or bitterness towards anyone. Minutes later, the rifles crack in unison and Edith Cavell falls. Her execution will spark international outrage, fuel Allied propaganda for years, and transform an unassuming nurse into one of the most celebrated martyrs of the First World War. But who was Edith Cavell? How did a vicar's daughter from rural Norfolk become the woman who defied the German Empire and paid with her life? This is her story. Let's begin in the English countryside in a time when the 20th century was still decades away. On December 4th, 1865, in the small village of Swardeston, near Norwich, Norfolk, Edith Louisa Cavell entered the world. She was the eldest of 4 children born to Reverend Frederick Cavell and his wife, Louisa Sophia. The vicarage where Edith grew up was modest but comfortable, not wealthy but respectable in that particularly Victorian way. Her father served as vicar of Swardeston for 45 years, a man of deep faith and moral conviction who taught his children that service to others was the highest calling. Young Edith's childhood was idyllic in many ways. She ice skated in winter, picked berries in summer, played tennis with her siblings, Florence Mary, Mary Lillian and John Frederick Scott. She painted, she explored the Norfolk countryside, and she absorbed the lessons of duty and compassion that her father preached from the pulpit. From an early age, the Cavell children were taught to help those less fortunate, even though the family themselves were far from wealthy. It was a lesson Edith would carry with her for the rest of her life. Frederick Cavell recognized his eldest daughter's intelligence early. She had a particular gift for languages, and he made sure she received the best education he could afford. She attended Norwich High School for girls, then was sent to boarding schools, first in Clevedon, Somerset, then at Laurel Court in Peterborough. The schools were strict, emphasizing moral discipline and rigorous academic training. There were no games, no physical exercise, just study, prayer, and the cultivation of Victorian virtue. At Laurel Court, Edith excelled at French, and this skill would prove pivotal to her future. But what does a young Victorian woman do with an education in languages and a mind full of ambition? In the 1880s, career options for women of Edith's class were severely limited: governess, secretary, nun, or nurse. Marriage, of course, was the expected path, but Edith never married. Instead, in 1886, at age 20, she took her first position as a governess to the Powell family in Steeple Bumpstead. For the next 9 years, she worked for various families, honing her French and saving what little money she could. Then, in 1890, came the opportunity that would change everything: a position as governess to the Francois family in Brussels, Belgium. Brussels in the 1890s was a thriving cosmopolitan city, the capital of a small but wealthy nation enriched by its brutal exploitation of the Congo. For 5 years, Edith lived with the Francois family, teaching their children, improving her French, and falling in love with Belgium and its people. She traveled to Austria and Bavaria, visited hospitals, and became increasingly fascinated by the emerging profession of nursing. When she inherited a small sum of money, she donated part of it to a hospital she had visited. The seed of a calling was taking root. In 1895, that calling found its moment. Edith's father fell seriously ill, and she returned to England to nurse him through his recovery, caring for him day after day, seeing the difference that skilled, compassionate nursing could make. Edith finally knew what she wanted to do with her life. She would become a nurse. At age 30, quite late by Victorian standards, Edith Cavell began her nursing training at the Royal London Hospital in Whitechapel in December 1895. Her instructor was the formidable Eva Lux, one of the great reformers of modern nursing and a disciple of Florence Nightingale's methods. The training was brutal: long hours, strict discipline, modest pay, and the constant presence of death and suffering. Matron Lux was not initially impressed with her new student. In her notes, she observed that Cavell had plenty of capacity for her work when she chose to exert herself, but criticized her punctuality and reliability. It was not a glowing assessment, but Edith persevered, driven by something deeper than mere ambition. In 1897, still in training, Edith was one of 6 nurses sent to Maidstone to help combat a devastating typhoid outbreak. She worked tirelessly, risking her own health to care for the dying. For her service, she was awarded the Maidstone Typhoid Medal. It was her first taste of crisis nursing, and she proved she could handle it. Whatever doubts Matron Lux might have had about her punctuality, there was no question about Edith's courage and dedication when lives were on the line. After completing her training, Edith worked at various hospitals: the Fountain Fever Hospital in Tooting, St. Pancras Infirmary, Shoreditch Infirmary. At Shoreditch, she introduced something revolutionary: home visits to follow up with discharged patients. This was rare in Edwardian England, where hospitals simply released patients and hoped for the best. Edith understood that healing didn't stop at the hospital door. By 1906, she was acting as matron in Manchester, stepping into leadership roles despite being relatively new to the profession. She was proving herself as not just a nurse, but an innovator and a leader. Then, in 1907, came the invitation that would define her legacy. Dr. Antoine Depage, one of Belgium's leading surgeons, was frustrated. His patients were dying not from poor surgery, but from poor nursing care. Belgium had no professional nursing schools. Nursing was done entirely by religious orders, well-meaning but largely untrained. Depage wanted to change that. He wanted to create Belgium's first secular nursing school, modelled on Florence Nightingale's revolutionary approach. And he wanted the best possible matron to run it. Through his wife Marie, who had stayed in touch with the Francois family, Depage learned about Edith Cavell, the governess who had become a pioneering nurse. He wrote to her with an offer: "Come to Brussels and build something extraordinary. Create Belgium's first professional nursing school. Train a generation of nurses. Bring modern medicine to an entire country." Edith accepted immediately. In 1907, at age 41, she became the matron of l'École Belge d'Infirmières Diplômées, the Belgian School for Nurses, at the Berkendel Medical Institute in Brussels. The challenge was immense. Belgium had no tradition of professional nursing. The Catholic Church viewed secular nurses with suspicion and hostility. Many doctors doubted that women could be properly trained in medicine. Edith faced resistance at every turn, but she was nothing if not determined. She introduced rigorous training programs, insisted on modern hygiene practices, demanded discipline and excellence from her students. She was known as a strict matron, punctual now, after those early struggles, and she expected the same from her nurses. If you were late, there were consequences. But she also cared deeply for her students, mentoring them, encouraging them, opening doors that had been closed to Belgian women. By 1910, Edith Cavell had achieved something remarkable. She had trained nurses for 3 hospitals, 24 schools, and 13 kindergartens. She founded Belgium's first nursing journal, L'Infirmière. She had earned the respect of doctors, patients, and the Belgian medical establishment. She was considered the founder of modern nursing in Belgium. The Belgian Florence Nightingale, the shy governess from Norfolk, had become a pioneer. Then came the summer of 1914, and the world exploded into war. In late July 1914, Edith was back in Norfolk, visiting her widowed mother, news from the continent grew increasingly dire. Germany invaded Belgium on August 4th, violating Belgian neutrality and drawing Britain into the war. The British government advised its nationals in Belgium to stay away. Brussels would soon be occupied. It was too dangerous. But when Edith's mother and the British authorities urged her to remain in England, she replied simply, "At a time like this, I am needed more than ever." By early August, she was back in Brussels, ready to face whatever came. The German army swept through Belgium with shocking speed and brutality. Civilians were executed as Francs-tireurs, guerrilla fighters. The university library at Leuven was burned. Tales of German atrocities, some true, some exaggerated, spread across the Allied world. By August 20th, 1914, Brussels fell to German occupation. The city that Edith loved was now under enemy control. Her nursing school was immediately converted into a Red Cross hospital. Edith gathered her staff and gave them clear instructions. They would treat all wounded soldiers, regardless of nationality. German, French, British, Belgian, it didn't matter. They were nurses, and nurses served all who suffered. It was a principle rooted in the Geneva Convention and in Edith's own deep Christian faith. The Germans allowed the hospital to continue Ibrucha operating, and most of the British nurses were sent home. But Edith and her assistant, Elizabeth Wilkins, chose to stay. For the first few months, everything was straightforward. The hospital treated wounded soldiers from both sides. Edith cared for German soldiers with the same compassion she showed Allied troops. She was obeying both international law and her own conscience. But then, in September 1914, 2 wounded British soldiers found their way to her door. These men had been left behind after the Battle of Mons, when the British Expeditionary Force retreated toward Paris. They were trapped behind German lines, wounded, hunted. If the Germans found them, they would be sent to prisoner of war camps, or worse. Could Nurse Cavell help them? Could she hide them until they recovered, then help them escape to neutral Holland? Edith Cavell faced a choice that would determine the rest of her life. She knew that harboring enemy soldiers was illegal under German military law. She knew the penalty could be death, but she also knew these were wounded men who needed help. She was a nurse. Her duty was to heal. On some fundamental level, Edith Cavell could not say no to someone who needed her. She hid the 2 soldiers in her nursing school for 2 weeks. When they had recovered sufficiently, she arranged for guides to take them across the border into Holland. From there, they could reach England. The operation was successful. The soldiers escaped, and Edith Cavell had crossed a line from which there was no return. Word spread through the underground resistance networks that the British matron at the Birkendale Institute would help Allied soldiers. Over the next 11 months, from September 1914 to August 1915, Edith became a central figure in a vast escape network. It worked like this. Wounded British and French soldiers, as well as Belgian and French civilians of military age, trying to avoid German forced labour, were sheltered first at the chateau of Prince Reginald de Croy near Mons. From there, guides would bring them to Brussels, where they would be hidden in safe houses, primarily Edith's nursing school, but also the homes of Philippe Boeck, a Belgian architect, Louis Severin, a pharmacist, and others. Edith would provide the soldiers with civilian clothes, false identity papers, money, and guides to take them to the Dutch border. It was extraordinarily dangerous work. The network was amateurish in many ways. Too many people knew each other's real names. Too many spoke too freely. Professional intelligence networks used code names and strict cell structures where no one knew more than they needed to. But Edith's network operated on trust and patriotism, which made it effective but also vulnerable. Still, the results were undeniable. Over those 11 months, Edith Cavell helped approximately 200 soldiers escape from occupied Belgium. 200 men who would otherwise have been prisoners were able to return to fight another day. But Edith was exhausted. The strain of living a double life, nurse by day, resistance fighter by night, was taking its toll. By May 1915, she had handed off much of the network's coordination to Philippe Boeck, and it was becoming increasingly clear that the Germans were watching. German military intelligence had not been idle. They knew soldiers were escaping in suspiciously large numbers. They infiltrated networks, followed suspicious individuals, gathered information. One of their agents was a French collaborator named Georges Gaston Quien. He pretended to be sympathetic to the Allied cause, gained the trust of resistance members, and then betrayed them to the German secret police on July 31, 1915. Philippe Boeck and Louise Tulliez, a French schoolteacher who worked as a guide, were arrested. They had been caught with French soldiers they were trying to move from occupied France to Brussels. On Louise Tulliez, the Germans found false identity papers, a coded address book, letters from soldiers, and French patriotic items. Under interrogation, despite her best efforts, information began to slip. The Germans pieced together the network. 5 days later, on August 5, 1915, German secret police arrived at Edith Cavell's nursing school. They arrested her and took her to Saint-Gilles prison in Brussels. She was placed in solitary confinement, treated as a major criminal. For 10 weeks, she was held alone in a cell, allowed no visitors except her interrogators. During her interrogation, Edith Cavell did something that shocked even her fellow prisoners when they learned of it later. She told the truth. She didn't deny anything. She didn't try to minimize her actions. When asked if she had harbored Allied soldiers, she said yes. When asked how many, she said approximately 200. When asked if she had helped them reach the Dutch border so they could return to fight against Germany, she said yes. She confessed to everything. Why did she confess so completely? Some historians believe she was trying to protect the others by taking full responsibility. Some think her deep Christian faith made lying impossible for her. Others suggest the interrogation was conducted in French but recorded in German, allowing prosecutors to twist her words. But the most likely explanation is simpler. Edith Cavell believed she had done nothing wrong. She had helped wounded soldiers. She had obeyed her conscience and her duty as a nurse. She would not lie about it. Her confession sealed her fate. The German military authorities now had everything they needed. On October 7, 1915, Edith Cavell was brought before a military tribunal at the Belgian Senate building, along with 34 other members of the resistance network. The trial was conducted in German, which most of the defendants didn't speak. They could hear the prosecutor, Lieutenant Stober, speaking for hours, repeating certain words over and over. Todesstrafe, death penalty. Stober read from paragraph 68 of the German military code. Whosoever, with the intention of helping the hostile power, or of injuring German troops, or any allied to them, is guilty of conducting soldiers to the enemy, will be sentenced to death for treason. He argued that the defendants were not innocent civilians who had simply helped a few lost soldiers. They were, he claimed, recruiting agents who had deliberately organized a sophisticated network to return fighting men to the Allied armies. Therefore, they were guilty of war treason under German military law. The defense was not allowed to call witnesses. The trial lasted just 2 days. On October 9th, the verdict was announced. Of the 35 defendants, 8 were acquitted. The rest received sentences ranging from 2 years to life imprisonment. 5 were sentenced to death. Edith Cavell, Philippe Boeck, Louise Tulliez, Louis Severin, and Countess Jeanne de Belleville. News of the death sentences sparked immediate international reaction. Brand Whitlock, the American ambassador to Belgium, was gravely ill, but his secretary Hugh Gibson and legal advisor Gaston de Laval, along with the Spanish minister Rodrigo de Saavedra, Marquis of Villalobos, formed an emergency deputation. At midnight on October 11th, they went to Baron von der Lancken, the German civil governor of Brussels, to plead for clemency. Gibson was blunt. He reminded the Germans of the international outcry over the burning of Louvain's library and the sinking of the Lusitania, which had killed 1,198 people, including 128 Americans. "This murder," Gibson said, and he did use that word, "will rank with those two affairs and will stir all civilized countries with horror and disgust." He pointed out that Edith Cavell was a woman, a nurse, someone who had helped German soldiers as well as Allied ones. Executing her would be seen as barbarism. Spain, still neutral, added its voice to the plea. Even Baron von der Lancken himself is reported to have believed Cavell should be pardoned because of her complete honesty and because she had saved so many lives, German as well as Allied. But the decision was not von der Lancken's to make. It belonged to General von Sauberzweig, the military governor of Brussels, and von Sauberzweig's response was cold and immediate. In the interests of the state, the death penalty must be carried out immediately. No delay, no appeal to higher authorities, no mercy. The execution would proceed before dawn. That night, Reverend H. Sterling Gahan, the Anglican chaplain of Christ Church, Brussels, was allowed to visit Edith in her cell. He gave her Holy Communion. They prayed together. Edith was calm, composed, even serene. She told the chaplain, "I am thankful to have had these 10 weeks of quiet to get ready. Now I have had them and have been kindly treated here. I expected my sentence, and I believe it was just. Standing as I do in view of God and eternity, I realize that patriotism is not enough. I must have no hatred or bitterness towards anyone." These words, "patriotism is not enough," would become immortal, inscribed on memorials across the world. But what did she mean? Perhaps she meant that serving one's country was important, but not at the expense of one's humanity. That even in wartime, compassion must triumph over hatred. That she regretted nothing she had done, because she had acted out of love, not nationalist fervor. In her final hours, Edith Cavell was thinking not about politics or nations, but about her soul and her faith. At 2 o'clock in the morning on October 12, 1915, Edith Cavell and Philippe Boeck were taken to the TIR National Shooting Range in Schaerbeek. 16 German soldiers formed 2 firing squads, 8 for Cavell, 8 Habresu for Boeck. According to witnesses, Boeck tried to make a speech, "Comrades, in the presence of death, we are all comrades." But he was not allowed to finish. Edith stood calmly, refusing a blindfold. The commanding officer gave the order. The rifles fired. Edith Cavell fell, killed instantly, or nearly so. She was buried quickly at the shooting range. A plain wooden cross marked her grave. The execution was announced by the Germans on October 12th in a terse official statement. The British and Allied press erupted in fury. The international reaction was exactly what Hugh Gibson had predicted. The execution of Edith Cavell became one of the great propaganda disasters of the war for Germany. In Britain, she was immediately elevated to martyr status. Newspapers ran story after story about the brave nurse murdered by barbaric Huns. Recruitment posters appeared showing Cavell's execution, with captions like, "Remember Nurse Cavell and enlist now." The British government, which had been unable to save her, now used her death to fuel the war effort. In the United States, still neutral, in October 1915, public opinion shifted dramatically against Germany. The combination of the Lusitania sinking in May and Cavell's execution in October convinced many Americans that Germany was indeed the villain of this war. Anti-German sentiment rose sharply. When the United States finally entered the war in April 1917, many historians credit Cavell's execution as one of the key factors that turned American public opinion. Even in Germany, there was unease. Some German newspapers questioned whether executing a woman nurse had been wise. The German Foreign Minister, Arthur Zimmermann, tried to justify it by saying, "In war, one must be prepared to seal one's own fate, but the statement only made things worse. The execution haunted German propaganda efforts for the rest of the war. Prime Minister Herbert Asquith spoke in Parliament about Cavell's sacrifice. What year in our history has done more to justify our faith in the manhood and womanhood of our people? It has brought us the imperishable story of the last hours of Edith Cavell. And in this United Kingdom and throughout the dominions of the Crown, there are thousands of such women, and a year ago we did not know it. Thank God we have living examples of all the qualities which have built up and sustained our empire. One Allied journalist wrote, "What Jeanne d'Arc has been for centuries to France, that will Edith Cavell become to the future generations of Britons." But the story doesn't end with her death. After the war, in May 1919, Edith Cavell's body was exhumed and returned to Britain with full honours. A memorial service was held at Westminster Abbey, attended by royalty and dignitaries. Her coffin was then taken by train to Norwich, where she was buried at Norwich Cathedral, near the village where she had been born. The funeral procession drew enormous crowds. People lined the streets to pay their respects to the nurse who had become a national hero. Memorials to Edith Cavell appeared across the world. In London, opposite the National Portrait Gallery near Trafalgar Square, a statue was erected showing her in nurse's uniform. On it are inscribed her final words, "Patriotism is not enough. I must have no hatred or bitterness towards anyone." There are memorials in Brussels, Paris, Canada. Even a mountain in the Canadian Rockies, Mount Edith Cavell, bears her name. In 2015, on the centenary of her death, Britain issued commemorative £5 coins with her portrait. Services and exhibitions marked the anniversary. A century later, she is still remembered. But who was Edith Cavell really? Not the propaganda figure, not the martyr on a pedestal, but the woman herself. The evidence suggests someone more complicated and more interesting than the simple narratives allow. She was not a secret agent or a spy. The Germans charged her with war treason, not espionage, and there's no evidence she gathered military intelligence. She was not trying to sabotage the German war effort. She was simply helping wounded soldiers, which she saw as an extension of her nursing duty. She was also not naive. She knew exactly what she was doing and knew the risks. She chose to stay in Brussels when she could have left. She chose to help Allied soldiers when she could have refused. She chose to tell the truth when she could have lied. These were conscious decisions made by a woman who understood the consequences but believed in something more important than her own safety. Edith Cavell was driven by faith, by duty, and by an almost stubborn sense of righteousness. She was strict, sometimes difficult to work with, not particularly warm or emotionally demonstrative, but she was also capable of extraordinary compassion and courage. She cared for German soldiers with the same dedication she showed to Allied troops. When she said she had no hatred or bitterness, she meant it. In an era of savage propaganda and tribal nationalism, Edith Cavell somehow retained her humanity. Was she a hero? Absolutely, but perhaps not in the way the wartime propagandists portrayed her. Her heroism lay not in hating the enemy, but in refusing to hate. Her courage was not in killing, but in healing. Her patriotism was in serving something higher than any nation, a moral code that said all human beings deserved compassion, even in the midst of war. The other three people sentenced to death alongside Cavell and Boque, Louise Thuliers, Louis Séverin, and Countess Jeanne de Belleville, had their sentences commuted to life imprisonment after international pressure. They survived the war. Why were Cavell and Boque executed so quickly, before appeals could be processed? Historians believe it was precisely to prevent appeals. The German military authorities in Brussels wanted to make an example, to terrify the Belgian resistance into submission. Instead, they created a martyr whose memory would inspire resistance for years. Philippe Boque, executed alongside Cavell, is less remembered but equally heroic. A Belgian architect, father of a young family, he had helped distribute the underground newspaper La Libre Belgique and organized the Mode du Soldat, a service that connected soldiers at the front with their families in occupied Belgium. He kept a journal during his captivity, published after the war, that reveals a man of courage and principle. When he tried to make his final statement, "In the presence of death we are all comrades," he was expressing the same idea as Cavell, that humanity transcends the divisions of war. In the century since Edith Cavell's death, the world has changed almost beyond recognition, but the questions her life raises remain disturbingly relevant. What do we owe to our enemies? How do we maintain our humanity in inhumane circumstances? When does duty to country conflict with duty to conscience, and which should prevail? These are not abstract philosophical questions. They're dilemmas that doctors, nurses, soldiers, and aid workers face in every conflict zone today. Edith Cavell's answer was clear. You help whoever needs help. You treat the wounded regardless of which side they're on. You act according to moral principles that transcend national boundaries. And if that costs you your life, then at least you die with your conscience clear and your soul intact. I must have no hatred or bitterness towards anyone. It's easy to honor such principles in peacetime. It's monumentally difficult when your country is occupied, your people are suffering, and you're asked to help the enemy. The fact that Edith Cavell cared for German soldiers even while helping Allied soldiers escape shows the complexity of her moral universe. She was not fighting Germans as people. She was fighting the occupation, the injustice, the violation of Belgium's neutrality, but she would not let political abstractions override her fundamental duty as a nurse. Today, medical neutrality, the principle that healthcare workers must treat all wounded without discrimination, is enshrined in international humanitarian law. It's part of the Geneva Conventions. Medical personnel are supposed to be protected, not targeted. Of course, these laws are violated constantly in modern conflicts. But the principle exists, and Edith Cavell's example is part of why. Her execution shocked the world's conscience, and reinforced the idea that there are some things that should be sacred even in war. In 1917, 2 years after her death, the nation's fund for nurses was established in Britain in Cavell's memory. Later renamed the Cavell Nurses Trust, it continues to this day, providing support and grants to nurses in need. It's a living legacy, helping real nurses in the same spirit that Edith Cavell embodied. Every nurse who receives assistance from the trust is a testament to the woman who gave her life for what she believed in. Edith Cavell never married. She had no children. She lived quietly for most of her life, teaching, nursing, building a profession in a country that wasn't even her own. For 49 years she was essentially unknown outside nursing circles. Then, for 11 months, she was a secret resistance fighter, and for the last century she has been a legend. But perhaps the most important thing about Edith Cavell is this: she would not have wanted to be a legend. She would have wanted to be remembered as a nurse who did her duty. She would have wanted people to care for the sick and wounded, regardless of nationality. She would have wanted us to remember that patriotism is not enough, that we must have no hatred or bitterness toward anyone, even in the darkest times. On that October morning in 1915, when Edith Cavell stood before the firing squad, she was not just dying for her country. She was dying for a principle that transcended countries, the idea that compassion and conscience are more important than borders or flags, that we are all, in the end, simply human beings who deserve mercy and care, that healing is sacred, and that those who heal should be honored, not executed. The rifles fired. Edith Cavell fell. But the values she embodied, courage, compassion, moral clarity, and the refusal to hate, those did not fall. They endure. In every nurse who cares for a difficult patient, in every doctor who treats an enemy soldier, in every person who chooses conscience over convenience, Edith Cavell lives on. She was, in the end, exactly what she wanted to be: a nurse, a healer, someone who helped people when they needed it most. The fact that this simple act of humanity required such extraordinary courage tells us something profound about war, about occupation, about the choices we all face when the world goes mad. Edith Cavell made her choice. She stood for something. And a century later, we still remember her name, not because of how she died, but because of how she lived. In the words carved on her memorial: humanity, fortitude, devotion, sacrifice, 4 words that sum up a remarkable life, a life that mattered, a life that still, 100 years later, has something to teach us about what it means to be truly human in an inhuman world. This was Edith Cavell, the nurse who defied an empire and paid the ultimate price for her principles. Her story is not just history. It's a mirror held up to every generation, asking, what would you do? Where would you stand? And are you brave enough to choose compassion over hatred, even when it costs everything? Edith Cavell answered those questions. And in her answer we find not just a hero, but a guide, showing us that even in the darkest nights of human cruelty, the light of human kindness can never truly be extinguished.